swollen or they're bleeding, it means there's existing inflammation. So she should go to a dental office and get it checked.
Okay, and one other caller was concerned because she had her upper wisdom teeth removed, but would this affect her lower teeth or cause any malpositioning over time?
Actually, that's a great question. So with wisdom teeth, the good thing is they're all the way in the way back. They usually will not cause any issues as far as malpositioning by removing them. Actually, something that I hear a lot of times is patients will say, you know, if I get my wisdom teeth out, will it make my teeth move forward? And actually, it has nothing to do with your wisdom teeth. It actually, teeth over time will move towards the front and towards the middle of your face. And so that's why sometimes you say, well, you know, I had braces like, 10 years ago, but how come my teeth are shifting again? And sometimes it's just natural growth patterns.
Let's take some live calls. Hey, you're on the air with Doc Talk. What's your question?
I have some kind of gum disease, and my dentist prescribed me some kind of mouth ring. After I was using the mouth ring, I'm putting my teeth, kind of getting discolored, kind of getting yellow. Do you think it's the reason that I'm using the ring, or any other reason that's getting discolored my teeth?
Okay. The rinse probably, which has been prescribed to you, is chlorhexidine, and it stains teeth. So it's only to be used for short term. So use it for short term, and then when you brush your teeth twice a day, I believe the color of discoloration will go away. But it's only to be used for short term.
All right, let's take another call. Hi, you're on Doc Talk. What's your question?
Question with the toothpaste. A lot of this toothpaste has a red symbol on it, and I know if they're red, it's actually not really healthy for you. And I'm trying to look for the green one, but only the organic one. There are green one that I started using, but I'm not sure the kids like that. So what is good? I mean, everything like Crest and Colgate and all, they all are red, and we all normally use it without any concern.
All right, so I think I might blow some minds here, but toothpaste, actually, if you can get whatever is on sale, usually the 99-cent tube is the best one because it has the least amount of compounds that could potentially cause an allergic reaction. Actually, toothpaste is a consumer-driven product as well. It really, it helps make your mouth feel fresh, but honestly, you just need the toothbrush and your brushing. The way you brush is actually what's most important. So toothpaste, honestly, get whatever tastes good to you and whatever's on sale.
Let's take some more calls. Hey, you're on Doc Talk. Turn your radio down. You're on Doc Talk. What's your question?
Question is, the teeth is not look white. We are doing a lot of brushing, but it looks yellow. My daughter teeth, she's doing 2 times the brush, and she has the brushes, but her teeth is not look white. So there is anything we can do it.
Absolutely. I mean, nowadays, whiter teeth, that's something that everybody asks about. Now, one thing is making sure you're not brushing too hard, because if you brush too hard, you can actually wear away the enamel, the white surface on the teeth, and expose what's called dentin, which has a yellow color. So it's very important to make sure you're not brushing too hard. Now, if enamel is good, the next thing to do is maybe talk to your dentist about some whitening options. They can do overnight trays, which are very effective. Sometimes some dentists have in-office whitening that can be done. And if you want to just get your feet wet, actually Crest makes a product, their white strips actually work pretty well. And even in studies, those are the most effective over-the-counter product to try.
All right, we're getting a lot of calls, so keep them coming. Hey, you're on Doc Talk. What's your question? Let's try another one. Hey, you're on Doc Talk. What's your question for our experts?
If you could comment on acid ulcers, canker sores, what causes them, how to prevent them, and how to take care of it once it has set in.
Yes, of course. So with aphthous ulcers, usually there is some kind of underlying cause. Now there can be a systemic component to it. There can be an underlying systemic disease that could have led to this process. It can also be sometimes a vitamin deficiency, a B12 deficiency, that can lead to it as well. Another problem can be the lack of saliva, and it can be traumatic ulceration. So the thing is, visiting your dentist, they can help at least find out what maybe the cause of this is and help you treat it effectively that way. You can see a regular dentist if they're uncomfortable with that. Then periodontists, myself and Dr. Kapoor here, we both actually trained in oral medicine as well. So we do treat these types of oral disorders.
Let's take another call. Hi, you're on Doc Talk. What's your question?
My question is, my daughter is 14 years old and she still has some baby teeth, two baby teeth. And should I wait? My dentist suggested that I should go for braces, but should I wait for the braces, or should she gets all the permanent teeth? So I don't know what to do. So could you please advise?
She should go and seek a professional dental opinion, and she may, that's the best way to go. She should go for an evaluation.
Also, the other thing is, I would definitely recommend seeing an orthodontist. They've been through the proper training so that they're better able to evaluate her specific growth patterns and see, you know, is it time for orthodontic intervention, or is it something else that needs to be done? And a lot of times, if we can treat some of these issues during the teenage years, then sometimes that treatment is a little bit more conservative versus what we may need to do once, you know, growth is over in adulthood.
All right, let's take another call. Hi, you're on Doc Talk. What's your question?
So for the person with braces, what's like the best treatment with like cleaning? Because I have like stuff in my teeth that are always stuck in there, and it's like really hard to clean.
Oh, absolutely. I can completely relate to you here because I was in braces for like 4 years. I had a headgear, had all that, the whole spiel. And so now what actually my dad, Dr. Kapoor over here, he got me on a Sonicare toothbrush as soon as I got my braces. And so those are actually really good at, you know, keeping your teeth clean around the braces. Another thing to actually try, it's called an interproximal brush. So they're meant to be used in between teeth, but they're just basically a small toothpick with a tufted end. You can use them around the actual brackets to help you clean some of those areas. The other thing that is important is to maybe talk to your orthodontist about getting a prescription for a fluoride gel. A lot of times we develop small baby cavities around the brackets just because food is there so often, and so if we can help prevent that process with maybe some extra added fluoride, you can prevent some discoloration after you get your braces off.
Okay, let's take another call. Hey, you're on Doc Talk. What's your question?
Very good evening. I have gap between my tooth and my teeth on the front. Rest of them are like intact. So what is the best solution?
Okay, so now the gap, it depends on how it came, okay? Sometimes we are, you know, born with it, and that's fine. Sometimes what can happen is in the presence of periodontal disease, in the presence of inflammation, teeth actually will move away from each other. And so this is called pathologic migration. And basically, the teeth are trying to get away from the inflammatory process that's occurring. So it's important definitely to seek an opinion of a dentist or a periodontist to see what the cause is. Now, if it's not due to periodontal disease and it's just kind of an aesthetic concern, well, there are some options there. We can talk about maybe doing veneers or crowns, or, you know, even some maybe orthodontics to help close that gap.
All right, we got another call. Hey, you're on the air. What's your question?
I had braces for like 9 months, and then I was given the retainers. But I wore them like for 2 months, and then I stopped wearing my retainers, and now they don't fit me. And I have seen like, you know, small gaps coming again in my teeth. So I was like, is there any advice? Can I restart my retainers? Do I need to remake them, or how does it work? That's my question.
I think you have to get back to your orthodontist, and they will advise you best.
All right, we got one more live caller. Hey, you're on the air. What's your question?
My choir teacher has oral cancer, so I was wondering, like, what is it? Like.
Yeah. So oral cancer. Now this is something that comes up a lot. Actually, we're on the last day of April here, but April is Oral Cancer Awareness Month. Now a lot of times we can have other cancers in the body, but they can show up in the mouth as well. Now these are things that need to be treated pretty quickly. The treatment a lot of times is cutting the cancers out, going through radiation, and then sometimes it also involves restructuring the face, adding in restructuring the jawbone as well. It just depends, but this is something that needs to be dealt with quickly, and usually with a cancer specialist, whether it be an oral surgeon or an oncologist.
Dr. Kapoor, does insurance cover dental implants?
Some of them have started covering dental implants, but dental insurance typically is not an insurance. It's a supplement. Usually it's $1,000 to $1,500 per year. So those insurances which do cover dental implant, they will cover up to that value per year.
And Dr. Menon, what are teeth in a day implants?
Sure. So I'm sure you guys may have seen some commercials online or maybe seen some billboards, but teeth in a day actually involve the replacement of all of your teeth. So a lot of times extractions, the tooth removal is done in the same day, implants are placed that day, the bone is remodeled, and then you actually walk out with a temporary denture that has been screwed in. And so then that way you're able to basically get a whole smile makeover in the course of a day. It's a great treatment option for certain patients, but definitely something we could definitely help you with.
Excellent. We had an excellent discussion today. Thank you, doctors, for being on our show. Folks, stay tuned for our next week's show. We'll see you next week again, same time.